Alright, in this video I'm going to show you how to perform the functional technique. So what you're going to do is you're going to approach the patient. You're first going to give them a style screen, so go ahead and relax into my hand. I'm going to rotate away, come back up. And I'm going to feel for whichever area has the greatest restriction. This greatest restriction is in the cervical spine, so I'm going to be treating in the cervical spine. Depending on where you feel the dysfunction along the spine, you're going to have a different handhold. So if you have a dysfunction in the cervical spine all the way down to T4, you need to use the head as your lever. If you have a dysfunction from T5 lower, you can rest your arm over the shoulder of the patient and then move them like this. So for Rob's dysfunction, his is in the cervical spine. So I'm going to find the lesion, going to assess for flexion and extension, so go ahead and push your head forward, please. And then come back. And look up to the ceiling, go back to neutral, that's good. So he has a dysfunction of FRS right. So what I'm going to do is I'm going to take the patient's head, I'm going to flex him, side bend, and rotate to the right, which is his freedom. From there, I'm going to add compression down to the level. So because it's higher up in the neck, I'm not going to add too much compression. So I'm going to push down to lesion, keep my monitoring fingers on the vertebrae, and then once I push, I'm going to feel the tissues start to unwind. And all that I'm doing is just following the unwinding. And after a few of them, you're going to feel the still point where the tissues are stopping to unwind. Keep compression, and then you're going to feel it going the opposite direction. Once you have that completed, it's going to stop again. Right here. When the treatment is now completed, you can take them back to neutral, re-screen to make sure that you treated it. So go ahead and flex forward for me. Now look up towards the ceiling, and the lesion is treated. That's how you do it.
Okay, for this part of the practical, we're going to ask you to palpate some of the tarsal bones, and we're going to ask you to palpate the borders. So the bones that you're going to have to palpate, you're going to either have to do a navicular, a cuboid, or the intermediate cuneiform. So we're going to go through them on the skeleton first, and then we'll do it on a real foot. So the first one we'll do is the cuboid bone. Okay, so it's on the lateral side. This is the lateral side of the foot. And the way that I would go about finding this, and the way that Weston described it in the lab, is you can go down the fifth met. You find the bump, it's called the styloid process, or the tuberosity of the fifth met. And what you're going to do is you're just going to let your finger drop into this depression here. And he described it as a pirate cove. So you drop into this cove or depression, and that bone that you land on is the cuboid. So that's how you're going to find the cuboid. So once you find it, you're then going to, you go up on the top of it here, and then you need to find the borders. So if you go proximal or posterior, you're going to feel an articulation point, and that is the border with the calcaneus. If you go more anterior or distal on the medial portion of the cuboid, and you feel an articulation point, that's going to be with the fourth metatarsal. If you go a little lateral, you go to the lateral portion of the cuboid and you go anterior or distal and you feel an articulation point, that's going to be with the fifth metatarsal. If you're on the cuboid and you go just medial, you're going to hit an articulation point, and that is with the lateral cuneiform. Okay, so now we're going to do that on a foot. Okay, so here we have a foot. Again, this is the lateral side of the foot. So what I would do is I would just go anywhere on the fifth met, just slide back. You're going to feel a bump. That's that tuberosity or styloid process of the fifth met. And then you sink into this cove, heart cove or depression, and I'm on a bone right there. That is the cuboid bone. Okay, so if I just go anterior and I feel, or distal, and I feel a articulation point, that is with the fifth metatarsal. If I go more medial and I go distal and I feel an articulation point, that is with the fourth metatarsal. If I just go medial, when I feel an articulation point, that's going to be with the medial cuneiform. And if I'm sorry, that's the lateral cuneiform. Lateral cuneiform, correction. If I'm on the cuboid and I go proximal or posteriorly and I feel an articulation point, that is with the calcaneus. Okay.
Now we are going to go over how to find the borders of the navicular bone. So you're going to go down to the medial side of the foot. You're going to find the medial malleolus. You're going to drop down to this first bump that you feel, and that's going to be the navicular. From here, you can palpate anteriorly, and you're going to feel the medial cuneiform. If you go a little bit more lateral, you're going to feel the intermediate cuneiform. And even more lateral to that, you're going to feel the lateral cuneiform. From the navicular, if you go posteriorly, you're going to feel the talus. So on your patient, what you do is you're going to find the medial malleolus. You're going to drop down to this first bump that you feel. From here, you are on the navicular. If you go anteriorly, you're going to feel the medial cuneiform. If you go more lateral, you're going to feel the intermediate cuneiform. And if you go more lateral to that, you will feel the lateral cuneiform. If you go posteriorly from the navicular, right about here, you're going to feel the talus. And those are the borders of the navicular. The final bone that you may be asked to palpate and find the borders of is the intermediate cuneiform. To find this, you palpate the second metatarsal, run down, and you will land right on the intermediate cuneiform. If you go anteriorly, you're going to feel the second metatarsal. If you go laterally, you're going to feel the lateral cuneiform. If you go posteriorly, you will feel the navicular. And if you go medially, you will feel the medial cuneiform. So if I'm going to palpate this on a real patient, I'm going to find their second toe, palpate the metatarsal all the way down until where I feel the bone. Once that I get to the bone, if I go anteriorly, I'm going to feel the second metatarsal. If I go laterally, I'm going to feel the lateral cuneiform. If I go posteriorly, I'm going to feel the navicular. And if I go medially, I'm going to feel the medial cuneiform. And that is the borders.
All right, this is the mesenteric lifts that will be tested on your practical. We are going to do ascending, descending, and then small intestine. So if I wanted to treat the descending colon, I would stand on the opposite side like I am. I'd reach across and sink on in and pull medially. If I feel a restricted area, I'll pull more medially on that area. Hold 5 to 10 seconds or until I feel it release, and then let go, and then rescreen. If I wanted to do ascending, I'll go to the other side. Again, I will sink in slowly and pull medially. Feels tight in this area, so I'll grab that area, pull medially, and hold until I feel it release, after which I will then rescreen that area to make sure it has released. Rob, lay on your side facing this way. For the small intestine, you're going to stand behind your patient, you're going to reach around in front, and you're going to pull up on a diagonal, and you're going to check your piano keys and see where it's tight. It's tight in this area, so both my middle fingers. And I'm going to hold those areas, and then it released. And then I'm going to rescreen to make sure my treatment was effective.